I believe you're going to be fascinated by this OrthoBrain Spotlight interview of Dr. Craig Hewitt. He shares insight into general practitioners providing orthodontics. Learn a bit about how he's been able to achieve the highest case acceptance of any general dentist or orthodontist I know. Listening to him describe his journey is helpful and inspiring. I'd like to thank our sponsors for this program, Kettenbach, makers of our preferred PVS impression material for orthodontics, and Dental Ceramics, creator of the mock smile to give a patient a glimpse into how beautiful you can make their smile. Dental Ceramics generously provides trial smiles at no cost for dentists that use their phenomenal laboratory services. Well, I'm delighted to shine the OrthoBrain Spotlight on Dr. Craig Hewitt. He's an amazing general dentist, an orthodontist, a perpetual student, and now an emerging OrthoBrain faculty member. More importantly, he's a humble, kind, and thoughtful man that's built a wildly successful two-man practice in Eaton, Ohio. His past experience even includes a stint in the Navy. And thank you so much for serving, Craig.
My pleasure.
He does a lot of ortho despite having a huge GP book of business. Full disclosure, Craig Hewitt was the original OrthoBrain client and consistently starts 100 orthodontic patients every year through our collaborative model. So one of the most extraordinary things about Dr. Hewitt and his practice is that he has the highest case acceptance of any orthodontic provider I've ever met, consulted with, learned from. I don't know of any other doctor that has a higher case acceptance than him, or even one that's close to his. Very unusual for him to present treatment and patients not to accept. Now, having said that, we can all have really high case acceptance if we let patients make up their own treatment fees and their payment arrangements. But he has good controls on those as well. And there is some secret sauce that's mixed in there. I'm real eager to hear all about it. And with that, let's get started with Dr. Hewitt. Why don't you start off by telling us how you got into this whole thing of doing orthodontics? You know, you finished the Navy, you learned a lot of general dentistry. I'm sure you had a ton of experience as a Navy dentist. How'd you stumble into orthodontics, or did you stumble? Maybe it was a thoughtful process?
Good morning, Ned. It's great to be here, and thank you for having me on here. Anytime I get a chance to obviously talk with you or even talk ortho, it makes for a great day. So I appreciate you having me on here and all the wonderful words. So my journey into ortho, part of it was I just kind of fell into it, but then the other part, it was kind of premeditated. If I go way back to my experiences as a patient back in high school, going to my dentist, having my orthodontic treatment, that was really just an eye-opener for me as to how people should be treated, how patients should be treated. And so for me, that was kind of the first step into orthodontics, was seeing what he did and seeing his lifestyle, his mannerisms, and basically, again, his treatment of the patients. So I've known all along, I think since high school, that I wanted to do something along that line. As I got into dental school, for me, it was a lot. That was an eye-opener, because not a lot of patients, not a lot of students, I should say, have any experience with general dentistry for the most part by the time we get to school. I mean, your early 20s, how many of us have had an implant, a crown, a bridge? So for a lot of us, it was doing stuff that maybe never had done before. So that was an eye-opener for me, and I really enjoyed that aspect of it as well. And so fortunately, I've always had that desire to get into orthodontics, but for me, general dentistry worked out fantastic. So yeah, after the Navy, honing my skills there, came back, and we moved back to a small town. And from there, I started to see a lot of friends, but a lot of new patients as well. And us general dentists, you don't get this, the orthodontist. That's why I'm so jealous. I had a conversation just the other day with my friend. He was a GP as well. And he says, I've got this orthodontist friend of mine. He's the happiest guy in the world. He's always smiling. He's never seen a bad day. And I don't know any orthodontist that has ever seen a bad day. I'm jealous. I love it. And, after reflecting on that, thinking about that, you've probably never had a patient come in and say to you, Doc, no offense, but I hate you. And that's, as a general dentist, we get that. And sadly, we get it on a frequent basis. And it comes from people that are good people. They're not mean. They don't mean to be offensive, but they just truly don't want to be there. And so for me, the eye opener was my first year or two in practice. I get patients come in and, and when we started to see more pedo, and mom says, hey, when do we need to get their wisdom teeth out? The other question is, when do they get their spacer, they call it. That's what it is around our area. They're just talking about some type of functional appliance that one of the orthodontists in the area does a lot of. And so for me, I thought, well, gosh, they're asking for something from a business standpoint. They want something I'm not providing, and they're wanting it at my office. And so from there, that's where I got into my journey of orthodontics. And I haven't looked back ever since. And it's just been something I'm so happy that I've added into my practice. It's something that I'm so happy to do on a daily basis. And it has gotten to the point now where we've grown it, that it's a major part of my practice. We'll spend, I don't know the exact numbers, but I bet probably it's somewhere between 20 and 35%, somewhere around there of my practice, my hours in the office are doing ortho, which is wonderful. We'll spend an entire day a week just doing ortho. So I get a taste of your life, Dan, and it's fun. I enjoy it.
Terrific. Well, I think in a roundabout way, you unintentionally answered the question that I had coming up next, and that is where you find the majority of your orthodontic patients, because I'm wondering if one of the secrets to your success is where your patients come from. In the case acceptance in some of the most highly coached orthodontic practices is somewhere around 66%. And there are some orthodontists who are deeply committed to learning best practices and have a lot of coaching and very polished at case presentation. And for those practices, if they're doing really well, they're around 66%. I was one of those practices, and I know how hard we had to work to get to 66 or 70%. And I noticed that you're way up in the 90s. So I'm wondering if there's some selection bias. Most of the people that come to the orthodontist have not been patients of the practice in the past. Tell us where your patients are coming from.
And that's a great question. And that's one of those you get to be jealous of me for a minute. And again, full disclosure, I've been to your office some years ago, and what a fantastic place. I mean, you couldn't do anything better than what that looks like. And I think that's a lot of the ortho practices, a lot of patients that I've talked with that have gone to orthodontists or so. They've got a wonderful practice. They're wonderful people, and their staff is fantastic. And that's what I'm always trying to compete with, are the orthodontists. So the case acceptance for me is something where they're patients of mine. And so that's the hard part. I would think, if I put myself in the specialist shoes, is, you've got a new patient in, they don't know you from anybody. The only reason they end up there a lot of times is because their trusted dentist sent them there. And so from my standpoint, I see these kids when they're 2 and 3 years old. We've got a family practice. We see everybody from 2 to 102. We've got multiple generations in our family or in our office. And so for me, it's starting that conversation at a very, very young age. So I'm looking at 3 and 4 year olds talking with mom and dad. I'm already talking about ortho at that point. Certainly there's not any treatment I'm going to do, but I'm letting them know that that's part of our routine exam. Every time they're in, I'm looking, as part of that dental exam, I'm looking at them from an orthodontic standpoint. And if I see anything that creeps up or anything that maybe we can help out, that's when I'll let them know. And so for me, it's already in the back of their mind. I had a great general dentist. He was kind of a mentor of mine. That he talked about a lot of things, but he said, plant the seed. And not everything has to be done at once. So plant the seed. And I think we all have those moments or those little sayings that really define our lives professionally, personally. And that was one of those. I don't try to do a lot of impulsive stuff. I try to kind of talk through the situation with the patient, their treatment. And so when the time comes, they're ready for it. Mentally, they're ready to go. And so for me, it's a lot of patients that they hit 6, 7, 8. If they need any type of functional appliance, okay, we need to do this next. Or if everything's looking good, yeah, we're in good shape there. let's just kind of let things continue to grow in. And once they're there, we'll look at it and see if there's anything that we want to change or improve. Great. And so I don't think there's ever any pressure, and not that a lot of orthodontists, pressure patients at all. They're wonderful at treatment planning. But for me, it's just an ongoing conversation. So the other part of it is I live in a smaller community, so many of them I've seen on the basketball court, on the softball field, the soccer fields, what have you. So again, it's that trust thing, and they really do. They trust us with their kids, and you've talked about that in some of your seminars before. I mean, is there any higher level of trust than that? And so for me, that's where OrthoBrain became so important. So I can touch on that a little bit later, but I think that's a whole nother topic. But I'll let you go ahead and keep moving on.
Well, it sounds like you naturally fell into some of the key ingredients in building a practice, and that is that you get out into the community, so your community knows who you are. You're not gonna build the practice sitting in your office waiting for the phone to ring. And you did it because you're a family guy and you have a family. It sounds like you also set the table so that patients are asking you when it's time to start, as opposed to if it's needed. So it sounds like you're setting them up so that they know. And in fairness to them, it's not a surprise when it's time to start, and they may have mentally prepared themselves for this, and also had some thoughtful process going around the idea of saving, and maybe making sure that insurance choices are properly made in advance. So you don't catch them off guard. So that's really helpful. But tell us, take some time and go through, let's call it patient acquisition, the process of a patient who is now ready to start orthodontics. Tell us what it feels like from the patient perspective. What are they going to hear from you? What are they going to experience? Because I think instead of looking at it from your shoes, I want to try and understand what the experience is like for the patient, because they're the one that says yes, right? And I think that's where the essential difference is. I think for a lot of doctors, they're looking at case acceptance from their eyes instead of putting themselves at the consult table or at the chair to see what the patient experiences. So tell us in depth what your process is, so that we can learn and help our practices.
Sure. You're putting the pressure on me, making me put myself into the patient standpoint. So I guess it goes from both ways, and majority of ours is pediatrics. So I guess I'll kind of look at it from the parent standpoint. They're sitting in the corner of the room while we're doing our exam on little Johnny. And so they've heard it time and time again. They come in, they sit down, and we have parents come back. This COVID thing is going to be a tough one for us, because most of these little guys, they're in the chair and mom and dad are in the room or floating around the hallway between rooms with their other kids. And so for moms and dads, they're right there. They're hearing all of our verbiage, everything we're talking with them about. And at the end of the exam, we'll talk with mom and dad. And just like I said, we'll say, here's our concerns from an orthodontic standpoint. This is what I'm looking at. And so right now at age 3, they've heard it. As we go through the exams, go through the years, they get 6, 7. And again, they're anticipating it is my expectation. They should know that I'm going to have some type of conversation about the orthodontic, level of the exam. And so they know somewhere 6, 7, 8, that's probably where we're going to start looking from a functional standpoint. Is there anything that we need to do orthopedics? And so if that comes up, I'll bring them over and I'll say, hey, okay, this is what we're looking at, and try to describe a little bit their bite. This looks good. If there's a posterior crossbite, anterior crossbite, that's such an easy one. I may not point out, a full class 2 or something like that, but certainly something that the untrained eye could see, I point that out. And so that's an easy one there. Oh yeah, the right side looks a lot different than the left side. You've done that as well. And okay, let's fix it. And so from that standpoint, now they've done that, they say, what's the next step?
So you've done a little bit of show and tell. Chair
yeah,
side,
absolutely.
Well, without any imagery. In question about that, does the hygienist have a role in that, or is that 100% you? Is your hygiene department, while they're cleaning teeth, are they looking? Do they have a role?
Um, yes and no. I should have them more. And be honest, probably should have them doing more. And their eyes are trained to it. They probably recognize more ortho than I would expect. Maybe quite a few general dental practices because we do so much of it. And I try to educate them as we go. You know what we're trying to correct with this appliance or that one. But really, our office is so busy with exams, and you've been in there before. I mean, there's not a lot of time to talk all these optional case treatment plans and such. So, and I wouldn't consider that optional, but there's other offices, like you said, there's other offices that do a much better job of case presentation than mine, for sure. And so I think from that standpoint, it's part of my exam at the end. So I'll go back and mom and dad say, okay, what's the next step for us? You know, we've identified this. What do we need to do to fix it? And from there, hey, we need to get orthodontic records. That's we'll bring you back. Or if you've got time now, we can do that. And it's probably 50-50. I think some of them they know it's coming. And so we'll do the records. They're not committed to doing the ortho at that point. But, the other 50 say, okay, let me look into the insurance part of it and everything else. And so we'll bring them back. They do the records. And from there, then we'll come back. And it depends on the patient, depends on the parents and the case. There are some that, their older brothers and sisters have already been through an orthodontic process, and mom and dad know it's coming. And so when that time comes, it's the same thing as, hey, we need to do a filling. Okay, take care of it. For us, it's not really any difference. We don't make a big deal of it. It's just routine dental treatment. And so they don't have any concerns. And then there's others, and and you've had those patients where mom and dad are real skeptical and questioning everything along the way. So for those, I'll bring them back for a separate appointment and sit down with them and look through their treatment plan, look through all the models and the pictures and everything, and make sure they're comfortable with it before we move forward. So I'll have a separate ortho review, we call it, appointment for them. But I would say that's probably more the exception than the rule anymore.
Mm-hmm. Mm-hmm. And in distinction to many of the dentists that we work with, you had a whole lot of orthodontic experience before you ever started with us. So there's a little nuance difference, I think, to what you're doing versus what the typical ortho brain dentist is doing. In other words, for a lot of the dentists, they're making the photos. They send the photos to us, to Ortho Brain. Ortho Brain does a perfect patient selection, right? Sends it back with predictability ratings and estimated treatment times and such. You've been doing ortho for 12 years, I think, before you ever got started with us. Is that
correct?
Accurate?
Yep.
Yeah. So you're a little further along, a lot further along in that regard, in terms of having an idea as to what things are going to look like going down the road.
Mm-hmm. Yeah, and I think that leads into one thing. It is, I think, from a general dentist standpoint, you get those cases, and I remember those early days where it's like I'm looking at the patient, talking with mom and dad. I can identify what's wrong, but I wasn't quite sure at that point, just at the surface level, what I needed to do to fix it. Right. And so my early days when I would do that was a much more stressful, trying time for me, because then it's me having the conversation with mom and dad. This is what's wrong. Let me think about what I need to do to fix it. And so at that point, for me, what I would do is say, let's take records. And this is one of my favorite lines for me is, let's take records. And once I have all the pictures, the x-rays, the models, once I have all that information gathered, I'm going to look at it on my desk, make my measurements, and we'll decide what's going to be the best treatment moving forward. So at that point, I hadn't committed to anything. I hadn't even committed to treating the patient. It was, I'm going to work them up, get all the information, and come up with a good game plan. And if after I looked at it, I thought, boy, this is out of my league, then it's an easy one for me. Have the conversation. A lot of times I'd call them up so I wouldn't waste their time. And, hey, Susie, Tom there, I looked at his case, and I'm really with this one, I'm going to feel more comfortable with you seeing the specialist. He's got some special concerns there. He really needs to see the specialist. And by the way, that fee I had for the records, we're just going to refund that to you. And that way you can take your information and take it up to the specialist, and you have that ready for them. So that way they're not out anything but time. They're not out any money. You know, in their eyes, I think they see me doing the right thing, and I can sleep at night knowing that. The others, if I look at it and say, okay, I got it figured out, that's when I would bring them back and say, okay, here's what we're going to do. Here's my treatment plan. Now let's move forward if you want.
So it sounds like there's a decision point as to whether you're going to do the case presentation all at one time, or if you're going to make pictures, call it imagery, pictures, x-rays, take a chance to take the opportunity to see them at a subsequent appointment, either because you want some clarification from OrthoBrain as to what the details look like, length of treatment, treatment plan, braces versus aligners, expanders, all that kind of business, how that all folds in, or the family isn't ready to hear it. Maybe you don't have you don't have both decision makers there, or they just don't seem in the right state of mind at that appointment. So this gives them a little time to come in prepared, maybe.
Yeah.
So it sounds like, you know, you've got that point where you make a decision as to whether it's 2 steps or 1 step for you.
Absolutely. And it does. It makes it a lot nicer just to be able to kind of everybody withdraw, feel comfortable, go to our comfortable space, make that decision, and then come back together. Yep.
Right. Well, as we were talking, you painted a picture as you were telling the story, and you know how I like to have, I like to teach, 15 reasons why a general practitioner has advantages over an orthodontist in delivering the care. And I think now in this environment, most general practices are not open bay. So you have some sort of physical barrier between chairs, which is probably going to add a whole nother layer of comfort to patients. And I don't know, you were in my practice after we had put those privacy screens between chairs. I think you saw that at some point. I think things will change in orthodontics to accommodate, but you've already got it.
Yeah, and again, that's one of those, I hadn't thought about that. That's a really good point. It will be interesting to see how this goes moving forward.
Right. Who does the case presentation? So when you have a patient come back, you call it an orthodontic review appointment. So at the orthodontic review appointment, who's in the room?
That's a great question. And it varies. It really, it's case dependent. So again, most of the time, hopefully we don't have to have those anymore. Sometimes it's strictly financial, in which case I don't want to be in there. You're probably the same as I was, and most general dentists, I think we don't want to be around talking money. I'll talk crown and bridge, ortho all day long. As soon as somebody talks about a dollar figure, I don't know what's going on. I get uncomfortable and I run out of the room. So for that part of it, I'll have my office manager come in, do the financial part of it. And if that's all we need to do, that's easy. And they've been doing more of that at home. Quite honestly, that I could almost see this teledentistry thing playing a huge role in that. Save mom and dad time to come in. It will make us more efficient. They can schedule a time to do that. And they still get that face-to-face interaction that I think makes it a little more comfortable than having that conversation over the phone. Hey, you're going to owe this much. So I could see that actually being a really nice advantage or useful technique with the teledentistry. If there's something more involved with the treatment itself, parents are all on board, but there's some compromises or considerations to take ahead of time. Maybe we're looking at extractions, maybe it's impacted canines, just anything that's not plain Jane ortho. We'll probably have them come in, and that's going to be something for my ortho assistant to walk them through. Okay, here are the OrthoBrain report, green, yellow, red. If there's a red on there, we're probably going to have the patient come in ahead of time. Even if there's a couple of the yellows, we'll have them come in for the review. So that way I know for a fact we can document mom and dad have heard us say these points are limitations for this case. So when I come in is when the mom and dad are wavering. They're not sure. And so that's when I'll come in and close the deal, as they say. But it's really just, I think, just for them to know, if they've got questions, I'm here, ask me. I love talking to them about it. But you and I know, once the ortho treatment gets started, you don't see mom and dad a whole lot. Right. I mean, they usually at the beginning and at the end, and for the most part, they send the kids in and get your stuff done and get them back out to me as fast as I can.
Especially next month when they have to stay in the cars.
Absolutely.
I thought I heard something, but I'm not sure I did. So I'm going to ask you.
Okay.
Did you say impacted canines?
I did say impacted
impacted
canines.
Will you
Yeah.
please tell our viewers, you treating impacted canines?
Oh, I have. And I think those honestly at the end are some of my favorite cases. I think you've seen Mackenzie. She's one of my favorites. She's the fair queen and everything else. I mean, to look at her where she was, with these canines that are gone, and now she's got just a beautiful smile. She's just the prettiest girl. And so for me, that was one. I don't know what it is, if it's this area or if you saw a lot of them, but my goodness, it's far more prevalent than I really recognized when I first got into dentistry. And so the crazy thing is, when I started into orthodontics, those were some of my early cases. So here I am. Who am I going to refer to as a general dentist with limited experience in ortho to have them do the surgery? So here I am into the braces, the canine not coming down. It's up to me. So here I'm laying a palatal flap and uncovering this thing and bonding a bracket in. And boy, oh boy, you talk about a puckering moment. That was it. But really, I think once I got through that and, had that first case done, boy, that was really neat. And I still get to see her now. The first one, I still remember the first one I ever did. And I think we're like that. She's coming in now, and her little kid, and this dates me. Her little boy, I think, is 4 now. So I'll probably be doing second generation ortho before long.
Oh, it's awesome when you can do that. I remember well when you sent me you sent OrthoBrain your first case with impacted canines. And I sent it right back and said, you need to refer this. Do you remember that?
I do remember that.
And it was Mackenzie.
Yeah.
And now
what a great finish.
Well, she gave us consent to use for teaching, so I often brag about you. And she's one of those examples where I know I've never met an orthodontist who can treat to a better standard than I show on cases like hers. It's as good or better than the work that I did. I think one of the cool things is that you even can do the surgery. And I remember I was so uptight about you doing the case. I sent you articles on the surgical procedures around that, which you already knew. But you walk the talk for sure. Tell me this. I think our viewers are going to want to know, especially doctors who don't have much experience doing case presentation, what are the hardest questions you're asked? So you're doing a case review, you're explaining treatment to a parent, and I'm explaining it more because Dr. Hewitt had no idea I was going to ask him the question. This is real. This is raw. He had no idea. Patients are going to ask questions. Do you find that some of them are difficult to answer? And if they are, what are the questions and how do you answer them?
That's a really tough one there. And thanks for giving me a little time to think about it. So really, I think probably the toughest question that I get is from the parents that say, well, what if we don't do anything? Or is it really necessary? And so from that standpoint, that's the neat part with us general dentists is we get to see, beginning, middle, end of a patient's life, the dentition, where things go. And I can't tell you how many of those just completely worn down, flattened class 2 cases or so where they've got the extreme deep bite, the 100% deep bite where you can't see their bottom incisors at all. At 12 years old, where they're going to be 20 years from now, 30 years from now. And so that for me is the compelling part of, their teeth are fairly straight. They don't look terrible, but you're going to have major issues down the road. And so, you can get by without treating them right now. But guess what? As an adult, he's going to have a lot of treatment ahead. And so that one there, I think, is the ones where the teeth are fairly straight to look at. The smile, the smile looks okay. They're not offensive when they smile or anything. They're cute kids. But functionally, the bite doesn't look good. So that's probably the toughest one for me. The other thing, and I think that brings up a good point, is we'll have occasionally patients where they'll end up going to the specialist to be seen. And that does not offend me one bit. If anything, I'm happy they did it. And that is part of every single case presentation from the day I started ortho. And I've said it to every single patient or every single parent is if you feel more comfortable seeing the specialist, please do. We've got great ones around. I love my orthodontists around. They're fantastic. Again, super happy practices, just awesome people. I mean, that's who I try to compete with. And gosh, such a high standard. And so for me, I want the patient to know and the mom and dad to know, look, if you're going to be more comfortable with the specialist, go there. At the same time, this is something that we do routinely here. If I have a case where, they come in, and that's part of the dialogue again, is if I've got a case I don't feel comfortable with 100%, I'm going to refer you, whether you want me to do it or not. I'm going to have you see the specialist because I want the best care for little Timmy too.
Mm-hmm. Mm-hmm. Yep. It's as you know, when we teach courses, we always say refer patients out if they have any interest in seeing the specialist, and encourage them to go. And
Yeah.
you have so many patients within your own practice that you can treat. There's no reason to try and talk
and
to it.
And
So,
I'm still doing their cleanings. I'm still doing their fillings, and I work great with that orthodontist too. So, I mean, our relationship is wonderful together. And so again, I've never had a patient or a family leave because they felt uncomfortable. I make sure they're 100% comfortable. If they go to the orthodontist, doesn't bother me at all. Just like you said, we've got enough work. I don't have to do every single case. And so I make sure there's no tension between me, the family, or the orthodontist.
right. Well, it sounds like the questions that people throw at you are the why, like, why do we need to do this? And it sounds like you're able to identify the why. So I think summarizing what you said, people want to know, do I need it? Why do I need it? Is this the right time for it? Will it hurt? How much does it cost? For the young kids, I know I've heard that line, hey, while they're little, the jaws are soft and squishy. As they get older, they turn into steel. So this is the urgency for doing it on some of the younger kids. It sounds like those are the questions where you're challenged.
They are, yeah. And I think we'll see the same thing with general dentistry is, why do I need to do this? Well, I guess you don't have to say number 18. You'll still live a productive life without that second molar, but
Right.
here are the benefits to doing it. And if they can see the benefit outweighs the downside, then, I think they're on board with it.
Mm-hmm. Mm-hmm.
Yeah. And again, it's always no pressure. And you're the same way. These are the benefits to doing it. And if it doesn't make sense to you or you can't justify it, that's fine.
So tell us a little bit, tell us a little bit about the issue of working the orthodontic procedures into your general practice. For you, when you have 100 patients that you're bringing into your practice every year, it's pretty sizable. So many of our doctors have no experience with orthodontics at all, so they have 0 patients. So advising them how they fold it in and how that evolves over time as they bring more patients in. Tell us what that looks like, because at one time you didn't have ortho patients either.
Right. And I'll kind of put myself back, maybe almost 2 decades ago, sadly. But I'll go back a ways and, think about those times when I first got started. And heck, my first ortho case, and this was years before Ortho Brain came about. I remember it was a good friend of the family. They'd been asking me for a while. And well, to be honest, I changed the diaper of the same kid back when I was in college at home. So helping my now wife, she was a babysitter, and so I was helping her watch the kid across the street. So here he is in high school now, and mom and dad are ready for him to get his braces on. And so we said, all right, we're going to do it on Friday. I'm going to have all the time in the world, and not kidding, Dan, 2 hours. The bracket, upper and lower. I mean, we did porcelain brackets. It was a disaster. So we saw them at the Ohio State football game the next day. Saw mom and dad. Fortunately, little Paul wasn't there. Absolutely. And so Mom and Dad were there tailgating with us, and Bethany and I pull up, get out of the car, say hi to everybody. And again, we've been friends forever. And they said, yeah, half of Paul's brackets came off. I was like, oh no, what am I doing? Why did I add this? And so fortunately, that's why I'm so jealous of these dentists now that have ortho brain. I mean, just everything is so much better, so much more straightforward, so much more efficient and so much more predictable. I'm just truly jealous because I was kind of out there in the Wild West trying to figure this out on my own. And so we got through it. But I think that was the thing for me is my assistant had absolutely zero ortho experience at all. Again, that's something with ortho brain. And this is kind of a neat little side thing is while we've had this time off, I'm looking at, okay, how do we work our staff? How do we protect our staff? And I've got an abundance of ortho treatment that needs to be taken care of as soon as possible. I mean, they've been out of treatment for, 7, 8 weeks, some of them. And so just to try to get them back on track, not that there's emergencies, but to try to get them back on track, I want to be pretty quick with this. So I've got twin 15-year-olds at home. And so over the last several weeks, they've actually been looking at ortho brain videos, how to change wires, how to put O-ties on, how to do power chain. I mean, I've got my 15-year-olds ready to go. And so I can't wait to deploy them on Monday morning in there working on, doing regular ortho. I'm so excited about it. So I think that's a big key for orthodontics in the general practice is finding a willing assistant that wants to learn and wants to do that. And it shouldn't be that hard. I've never had a hard time convincing an assistant, especially one of my lead assistants, to do that because number one, they're awesome. They want to work hard anyway. But number two, they get it. And it's that autonomy that they own something. And that's something a lot of assistants in general dentistry don't have. They don't have a process that they own. There are assistants. Whereas with ortho, now you've given them something that they're in charge of. Again, they come in for a review. She's meeting with mom and dad. They're building the relationship with these kids. And that's a powerful thing for any of us. But from an assistant standpoint, to be in that role is just magical. And so I think for them to be able to find the skills to do it, before it was me teaching them, before ortho brain, I would have to sit down and teach them. And gosh, that was such a big deal for me because when am I going to find time on the side to do it, let alone fumble around with the patients learning myself? My girls have done this ortho brain training, I'll say, on their own. I've been out, whether I've been out at the office getting stuff ready, I'll come back and, hey, Dad, check this out. They're doing power chain in no time. It took me years to get as fast as they are. And so it's just, I think ortho brain has given me the ability to train assistants without having to sit down and do it myself. And if you've got an assistant that wants to do it and has the hands to do it and has the interpersonal skills to do it, well, I'll tell you what, ortho is a no-brainer. So I think if I'm going back to my days, when did I schedule it? At the end of the day, just like any other new procedure, do it when you've got time to mess up, you've got time to figure things out, and mom and dad are happy, the kid's not in school, and they're just sitting there at the end. So for me, getting started, I do it at the end of the day. That's when a lot of our ortho is anyway. And, I identify that one assistant that you really want to place your trust and faith in them carrying the program, because that's what it is.
So it sounds like you take advantage of the ability to leverage your time. You find somebody in your office who's accountable, committed, has the capacity, whether it's intellectual or hands, they've got the capacity, the interest, the desire. They're going to own it, have a kind of a mindset where they own the responsibility for doing things well and to make you look good.
Absolutely. You always say it's you kind of just running the symphony on your own. Right. All you're doing is kind of pointing them in the right direction.
Well, tell me this. This is something I've wondered, and as the viewers already know, you don't have a list of questions in advance. I often tout you as a general dentist that performs orthodontics at the highest level, even as if you were an orthodontist. In other words, there's no higher level black belt than what you're doing. Nevertheless, you use OrthoBrain, you use the collaborative platform for your patients routinely, even though you've got all this experience. Help me, because of course I want to know what it is that you find appealing when you're already so good at it. What is it that you find helpful, even for patients you have confidence in with regard to your diagnostic capabilities and treatment planning capabilities? Tell us the value proposition.
Yeah, I think that's a great question, because it is. It's something, certainly as general dentists, we're, well aware of our overhead. I think it's something where we can kind of cut costs where we can. But at the end of the day, it's all about taking the best care of our patients. So I'll ask you, Dan, a real quick question. Have you ever had a case that you're not 100% absolutely thrilled with the end result?
Heck yeah.
Okay. All right.
Almost all of them.
Yeah. Yeah. I'm sure it didn't happen much to you, but I mean, I've seen less than, perfect results from amazing orthodontists. Like I said, the orthodontists around me are just fantastic. And I've seen some where I'm like, well, that's not a perfect class 1 occlusion. This smile's a little gummy or so. So, but we're working on the human body, and it's truly an amazing thing, but it's rarely perfect, as we know. But that's our standard. That's what we measure ourselves to. And, for me, that's something I measure myself to the capabilities or the standards of an orthodontist. Not to say I have the knowledge, the experience, expertise, or the ability of an orthodontist, but if a patient can walk into an orthodontist office and get a certain level of treatment, why should I be providing anything less? So, and so as far as, having cases that maybe we're not 100% thrilled with, I hate to tell you, but it happens in general dentistry too. I mean, there's, but there's limitations to it. There's some things that we can't get around with endo. Sometimes we've got a really curved root, a dilacerated root. And there's limitations to what the metal can do. With implants, sometimes we just don't have enough bone to work with, and maybe that implant isn't exactly where we want it. Crown and bridge, sometimes we don't have enough tooth structure, or sometimes you got those straightforward, easy cases. It's a simple occlusal composite, and you say, this is a no-brainer. I could do this with one eye closed and half asleep, and for whatever reason, they come back sensitive, and it's just, it drives you crazy. And so I think I see the same thing with ortho. We've got some of those same patient physical limitations. Sometimes there's, skeletal issues, and then other times it's what the patient can tolerate. So, I think as long as we know what those predetermined compromises are, sometimes there's financial considerations. Mom and dad can't afford to do this. I mean, sometimes there should be surgical cases that we maybe try to camouflage or so. We've had some cases, hygiene, patient doesn't do a great job on hygiene, and, we've got to finish treatment early. And then I've had some of those late growers have done enough where we finished the ortho at 12, 13, man, beautiful class 1 occlusion. And you watch them grow and you watch them grow, and you ask them if they're wearing the retainers. And they said, yes, mom and dad confirm. And you just watching this mandible grow, the overbite decreasing, and gosh, it's just, it just makes your heart sink. And then there's things with ortho that maybe don't come out perfect because of my own ignorance. And I've heard you say you don't know what you don't know. And so I think the two big differences between ortho and general dentistry in my eyes, one is with general dentistry, we're used to instant feedback. We do something wrong, we do something that doesn't come out right, the filling doesn't work, the crown comes off, the bridge comes off. So a file breaks in a root. So we get instant feedback. Okay, I won't do that again. With ortho, it's a lot different. It's a 2-year process, sometimes 4 or 5 years if we're doing 2-phase orthodontics. And so by the time we get further down the road, for me, it was, did I do the right thing in year 1 of this 5-year treatment? Or maybe should I have done something different? And so the second thing, the difference between general dentistry and ortho is, especially if we're working on pediatrics, we're making a forever change in their bite, their smile, and their overall appearance. And it's like you said, their bones are squishy when they're little. So we're making bony skeletal changes on kids. And so when you think about it, that's a lot of pressure. And mom and dad are putting that ultimate confidence in us to take the absolute best care of their kid. And so as I treated more and more cases, I began to see some of those cases in my eyes that weren't 100% perfect, you know. And so, you know, it's just, we become more comfortable with the routine stuff, and start to push our limits, even against some known compromising factors. So, you know, we know this is going to be a little compromise, but we still want to treat it, because this skeletal class 2, you know, the orthodontist isn't going to be able to overcome a skeletal problem or compromise any different than me, but they may have other options there. So where it got to for me, and so in a long answer to why do I spend more money, or why do I increase my overhead to do the same thing I was doing before, is it comes down to peace of mind. So at night, you know, I'd be laying there at night with these ortho cases thinking, gosh, it's not 100% perfect in my eyes. I'm okay with some of those other things that I can't control. But if it's not perfect because of the last one, because of my own ignorance, you know, because I didn't know what I didn't know, then I have altered or impacted this child's life forever. And so for me, it's about peace of mind. It's being able to get a good night's rest. So with Ortho Brain, and that was I guess that was a defining moment, to be honest, and it was a defining moment in my life, because it gave me the confidence to treat orthodontics, to treat more cases, knowing that Ortho Brain was in my corner, that I had a specialist in my corner looking over my shoulder and telling me, you need to do this, or don't do this, or you know what, this came out that way, and that's as good as anybody can get with it. And so at the end of the day, it's all about peace of mind. Money's great, you know, but at the end of the day, that doesn't help me sleep. What helps me sleep is knowing I've done everything I can to the best ability possible for my patients. And, you know, I've done as anything I can to help out with little Timmy there. And so really the increased overhead was well worth it for me, just to be able to sleep at night.
Well, yeah, I mean, it's really remarkable, because I think for most dentists that are endeavoring to do orthodontics, it becomes the most profitable thing they do in their practice. You know, the only other thing that's probably up there would be maybe surgeries. And, you know, this doesn't involve IVs and advanced cardiac life support training and all the attendant responsibility that comes with it. So it's a really profitable endeavor. The only thing that's more profitable is to be able to do it, you know, having gone to residency and get schooled up. Your tuition was, you did it for 12 years, right? So, and for others, you know, there's really only a few ways to get to the point where you can do everything like you do. One, you go to a 3-year residency, you spend $150,000 or more on extra tuition, you know, 2, 4, 6,000 or 8,000 extra hours of education. You know, that's 3 years, 8,000 hours of education plus $150,000, and now you still need help, right? So you have to have a study club or something if you're an orthodontist. That's what we did. Or you do it the hard way, where you kind of do the hard grind through it, learning and taking all the classes and just trying to find your way over 12 years, and you still found that you benefit from collaborating. The interesting finding from our perspective, what I see is that you have a high number of questions that you ask at the end. So you always order these ultimate packages. And for folks that aren't familiar with the collaborative platform that we have, ultimate package means you have unlimited concierge level support and on-demand education to freshen up, just like you're giving for your daughters. And you use that a lot at the end. You know, you'll send us pictures and you'll say, hey, Dr. Hewitt's looking for some finishing help. And I'm looking, I'm like, I'm going to have to put my loops on. And so you're really getting into the fine nuance of how to, the difference between doing decent work and good work, and then the difference between good work and great work. So I think that's where it is. I know that you've shared a lot of information with us today. I mean, it's a whole lot. The thing that strikes me the most is how comfortable you seem to be speaking. If you remember, some time ago, I asked you, I said, hey, would you do you think you could share a little something at one of my courses? Would you stand up and just tell people what it's like? I mean, dentists want to hear from other dentists. And I remember you telling me, I would do anything for you. The way I remember it, I know things never were the way they used to be, but the way I remember was, there's a lot I'll do for you. There's not anything you can ask me that I'd say no. I get really nervous talking in front of people or standing up in front of people. Now all of a sudden, look at you.
Absolutely. I saw sweaty palms, so I'm not sure I'm ever going to get over the speaking thing, but oh gosh, I remember that. And sadly, I remember it like it was yesterday, because it's been a lifelong fear of mine, the public speaking, and people talk about it, but I mean, it really was to the point where even for me, just talking in front of our team huddles in the morning, eight girls there that I spend every day with. Yeah, I spend more time with them than my own family. But to have 8 women in front of me talking at our morning huddle every day, gosh, my heart would still start to race. I mean, it's just, I could sit and talk all day with patients, but I would rather do a week-long DO amalgam on 15, do those in a cycle for a week long than to get up and talk in front of a group of 100 people for, gosh, 5 minutes or so. So when the first time you mentioned that to me, it was for me, I've seen you speak. I mean, I'd watch you give that Invisalign lecture where we were up at the, I think, Dade Country Club, and I think you had 500 people in that room. They opened up every single room to this place. And I met you at a meeting before. We had a nice one-on-one conversation. I felt like we were just two buddies catching up. And then I see you a few months later at this Invisalign meeting at 500 people, this fantastic spread. And I'm thinking, I know that guy, he knows my name. And so just to see you out there, it's like, wow, this is a normal person that's able to do this. How in the world? And so we had that conversation about it. And you shared with me at one time that it wasn't necessarily your favorite thing either, but you kind of got through there. And so it was just one step at a time. But, and that's one of the things I've gotten from OrthoBrain, was something I never expected. And, I think it's beyond my wildest dreams of some of the stuff I've done since, as far as, just getting up in front of some other dentists and talking about my experiences, stuff that I know really well. It should be easy to share. So I think that was really neat. But it was, I think it was about a year and a half ago, I was asked by one of the people in the community to speak at a honors luncheon. So it was a scholars dinner. It was a scholars dinner that I had gone to as a student back when I was in high school, and now my son, he was a junior or a sophomore, was doing it as well. And I said, you know what? I think that would be something, now that I've had a couple opportunities with an OrthoBrain, I think I'd like to go ahead and push myself. Just like we say, you get comfortable with something, you say, all right, I'm going to push the limit, see how far my body will take it. And I said, yeah, I'll go ahead and do that. And said, how many will you be there? Probably, I don't know, maybe you said there'll be quite a few. So I started doing the math in my head, adding up the students for all the county schools, which is maybe, I think, 5 or 6 schools. We're in rural Ohio, so it's maybe 5 or 6 schools. I started adding up all the kids, parents, did the multiplication, and I'm thinking, okay, it's maybe 100 or so. That's fine. So we get there, and I see all the tables out for where the dinner is, and I'm thinking, well, this is kind of a lot more. And I asked her, I said, Laura, how many people are going to be here? Oh, I don't know, probably about 300. You talk about my heart racing. Oh my gosh. And so I did. It was all in preparation. I went through the speech again, and Dan, you'll appreciate this. So while everybody was out in the hallway having the dinner, kind of out in the gym area, the auditorium, which is a big one, was empty, and I couldn't eat anything. I mean, heart's racing. It was like I was getting married again. I couldn't do anything. So I said, took my daughter in, same 15-year-old now. I took her in there. She'd been my audience for the past week. And I said, let's go in there. We're going to go through it one more time. And so I went through the whole thing with an empty auditorium. And I tell you what, we got done with that. And crowd came in. Everybody's standing there. And it took me a few minutes. But then I settled in, and I really felt comfortable talking about that and going through that presentation. And really the cherry on top for me is once I got done, they did their ceremony and everything. And at the end of the ceremony, everybody was talking. I went down and talked with one of the moderators for that. And while I'm talking to him, the principal for our local high school comes up and says, Craig, hey, you did really well. He said, would you be interested in giving the Veterans Day speech this coming fall? And, so any worries, concerns I had were gone. Yeah, I said, absolutely, I'm in. And so then I got to, the following fall, I gave a Veterans Day speech in front of the whole high school. So 500-600.
It's amazing. Somebody was kind enough from the family. I had a heads up on that one, so I got a little documentation on it. But what I'm hearing, Craig, is that your journey as a speaker and presenter and being able to stand up in front of people, it really seems like the path and the journey was so much like what you've done in orthodontics, where you figured out how to overcome the inadequacies that we have. You're born with most of us are born with a fear to speak in front of people. That's really common. And you found a way to overcome it the same way that you were able to overcome the challenges that you were facing with orthodontics, and that you learned, you pressed, you pushed, you brought in help, and you found abundant success. And now what you're doing is you're teaching your kids the same things that you found in order to find success. So what I'd like to do is say congratulations to you for anything and everything I've ever been able to share with you. I learned from you in the same way, and I find great inspiration when I see people that are really becoming the best they can be. It's not so much whether you're the best in the world, and you happen to be. I believe you are. You have the #1 case acceptance of any dentist or orthodontist I know, and the quality of your work is second to none. And I'm talking about orthodontists and dentists. But what impresses me is I truly believe that as you're playing this game of life, you are truly becoming the absolute best Craig Hewitt you could ever be, which is what a tribute to your parents. So I applaud you for that. Congratulations. Thanks for all that you do for me, for OrthoBrain, for our colleagues, and for making time. I know you're busy, and I look forward to many more years of learning together. So signing off now, and I hope all of you enjoyed this OrthoBrain Spotlight on Dr. Craig Hewitt as much as I enjoyed the interview.
Thanks, Dan. I appreciate it and everything you've done for me.